What if you have gum disease, like periodontal disease?
Yeah.
Can you do implants or no?
Yeah, of course, that's what we get.
Okay.
That's what we get. I mean, most everybody that that ends up needing implants is because of gum disease. You know, I mean, gum disease is the number one cause for tooth loss in the world. So yeah, for those people that that have gum disease, that have infected gums and moving teeth and everything, yeah, those are the prime candidates.
So what do? You clean up the gums?
Yeah, of course. I mean, the first thing that we do is that the first thing that we always need to do is remove infection.
Okay.
I mean, the first thing we need to do is just have a clean workspace. If I'm gonna work on this desk and I'm gonna shine it, I'll clean it first. I'm gonna do a brand new desk, but first I'm gonna clean it. I'm gonna do nice shiny, no infections. I'm gonna remove whatever is bad, whatever bacteria, bleeding, everything that is bad in there. I'm gonna take care of. Then when everything is nice and healthy, now I'm going to replace, and now I'm going to replace your teeth in whatever way we're going to replace it.
And people that have gum disease can still get this done in that fast way.
Yes, 100%. Yeah, even if you have gum disease, even if you have active gum disease, you can. There's a lot of misconceptions up there. There's a lot of misconceptions. There's a lot of things that people think they cannot get it. A lot of people, well, I cannot get it because I have gum disease. Yes, you can. Well, I cannot get it because I have bone loss. Yes, you can. Oh, this has to do with mother. I'm not gonna get it because I'm diabetic. Yes, you can. I mean,
now you're saying you do 90-year-olds, 80-year-olds.
Yeah.
So these people are on like 7 medications sometimes.
Exactly.
They could still do this.
Yeah, of course. Why not? I mean, yeah.
Do you ever have to call their medical doctor?
All the time.
Okay.
Yeah. One of the first things that we do, yeah, of course. And every patient that we see, we coordinate with our medical doctors. I mean, every surgery that we do, of course, yeah, we're gonna call your doctor. We're gonna make sure everything is fine. I go through a list of medications. If you're taking certain medications, a lot of people say to me, well, I cannot do it because I'm diabetic. And I'm okay, yeah. Are you controlled? Yes. You take your meds? Yes.
Right. They can do it.
Of course. I mean, everybody's diabetic nowadays.
Now, all the new books, The End of Alzheimer's by Bredesen.
Yeah.
Okay. Stephen Gundry, the heart surgeon, they're saying if you have a bacterial infection in your mouth, and I've had them on the show.
Yeah.
Bacterial that things are leaking into your bloodstream, causing inflammation, causing an immune response. Have you found, and I was really wanting to ask you this, that when you clear up this infection, do they feel more energy? Do they feel better?
Yeah, imagine this. So you have an infection in your mouth. It's always there. It's been there for years. Your heart pumps blood, once per minute all over your body. Same blood goes all over your body once per minute. It goes through your mouth also. So your blood is going through that mouth and is going through that bacteria, once per minute, boom, boom, boom. So imagine all these years, you're pumping blood, and that blood is going through your mouth, it's going, oh, hi, Mr. Bacteria, grabbing that bacteria, maybe I'll grab you, and then I'll bring you to the heart, and now you're gonna have a heart problem.
Okay.
Everything is connected, and that's true. So, yeah, there's studies on this.
So when you clear up this infection, my question is, do they feel better?
Of course they feel better because now the body is not fighting the infection anymore.
Okay,
yeah, your body is
good.
always fighting something. It's always stressing about fighting, sending white blood cells or whatever to fight an active infection. It's an active infection. Once you don't have it, imagine your body's like, now I don't need to fight that anymore. Of course you feel better.
It's like having a flu and you have no energy because you're fighting something.
Your body's fighting something.
So now you don't have it.
It
seems like you'd have more energy.
Yeah,
okay.
Now you feel better, and they do feel better. Yeah, of course. You don't have something bugging your system anymore.
And the breath gets better?
100%.
Because I guess gum disease causes bad breath, or is one of the causes?
Oh, well, it's probably the main cause of bad breath. Yeah.
So that goes away.
When you take care of gum disease and when you take out the bacteria in the mouth, bad breath goes away. If it's coming from the mouth, yeah, for sure, 100%. That's where it's coming from.